Visit us at Sunway Medical Centre if you wish to know more about speech and hearing services. Sunway Medical Centre is an Australian Council on Healthcare Standards and Malaysian Society for Quality in Health accredited private hospital. Sunway Medical Centre offers a comprehensive range of medical services. These include facilities and advanced medical technologies for outpatient and inpatient specialty care, health and wellness program, and 24 hours emergency services. These are supported by over 1,000 dedicated personnel, including more than 150 medical consultants, professional allied health staff, as well as trained and dedicated nursing staff. Sunway Medical Centre is affiliated to Jeffrey Chia School of Medicine and Health Sciences, Monash University, Sunway Campus, to meet the demands of medical education, training and research. Yung was born on 4th December 2011. Her presence was a blessing to her whole family. As months went by, her parents noticed something different with her.
Yung development was pretty normal until maybe after her 1-year-old birthday, that I noticed that she made a lot of noises, but nothing sound meaningful. No papa, no mama. Her normal favorite food also, she doesn't really pronounce it correctly, although we use it every day. So, yeah.
So she doesn't respond to the name Yong Yong?
She doesn't respond to her own name. Yong Yong! After her first birthday, that since we noticed she didn't have meaningful words, so we decided to go to search for some doctors' advice whether she had any problem, because every time we call her from her bag, she doesn't respond. But when she notices, her response is very quick, so it's a very big difference. When we go to see the doctors, I was holding Yung Yung on my lap, and then the doctor was sitting in front of me, and then the doctor was just doing like that, and then Yung Yung would just look, and then the doctor says it's okay, and then the problem just subsided a bit, and we actually went for 3 doctors and 1 pediatrician. All of them says she is okay. So because her response, she's very observant, so her response is pretty quick when doctors do like that in front of her. So then after our we went to an overseas trip. After the trip we came back, and then it was a leisure time, and opened a newspaper, and I saw a newspaper report on this cochlear implant on a child, and the parents interviewed. So then I decided that I must go to see a specialist to have Yung Yung do that hearing test properly. The ENT specialist says there's 3 hospitals in Malaysia that can do this objective hearing test. 2 is governmental hospital, 1 is private. So, and that private hospital is Sunway Medical Centre. We want to do it fast, as soon as possible. So here we are in Sunway Medical Centre.
Children with hearing loss usually will fail to respond to a normal conversation speech, or sometimes they may ask for repetitions. For children, we have 2 types of hearing assessment. The first one is a behavioral assessment. The second one is objective assessment. For children at the older age, for example 3 years to 6 years old, they can use the techniques called play audiometry. So whenever they hear the sound, they need to put the marble in a marble track. For the second assessment for kids at the younger age, for example 6 months to 2 years, 6 months or to 3 years old, the techniques that we use is called visual reinforcement audiometry. So whenever they hear the sound, they will turn and look at the puppet as the response. Certain kids, they may not able to give a reliable and consistent response. Then we have to do objective assessment. There are two types of tests in objective assessment, which are auditory brainstem response and auditory steady state response. For both tests, we need the child to be in a sleeping condition or either sedated with the chlorohydrates. Once they sleep, we're going to put on the electrodes on the surface, the two forehead, and another two is at the mastoid behind both ears. And we're going to use the insert phone as a transducer to deliver the sounds in the ear. So these two tests was aimed to record the responses around the hearing nerve. From that, we can determine what's the hearing level of the child.
Yung had her first cochlear implant surgery done on her left ear on 11th July 2013. On 25th July 2013, after 2 weeks of wound recovery, Yung had her first experience in hearing when the cochlear implant was switched on.
I give some amount of current level to stimulate the implant. So this point here is at least we can see the reaction.
A cochlear implant helps people with severe to profound sensory neural hearing loss or nerve deafness. A cochlear implant has two parts: an internal part called the cochlear implant and an external part called a speech processor. The speech processor uses two small microphones to pick up sounds. It turns those sounds into signals and sends them to a transmitter. The transmitter sends the signals through the skin to the internal implant. The internal implant converts the coded signals into electrical energy and sends them to the electrode array. This stimulates the nerve fibres in the cochlea, and the signals are recognised by the brain as sound.
What was Yung reaction after her first cochlear implant procedure?
She become more noisy. Of course, more sounds than before, and she start to express in a different way through a sound that we never come across earlier.
来，姐姐来，姐姐来，坐下。
The role of a speech-language pathologist is to guide parents on how to teach cochlear implant children to make sense of sounds. From here, the children learned language, speech, and communication skills. Yung is speaking now. She utters 1 to 2 words to communicate. Her language development is 6 to 12 months behind children her age. With cochlear implant, Yung will still need habitations with an audiologist and speech-language pathologist.
With two cochlear implants, we have the advantage of binaural hearing. The first advantage of a binaural hearing is localization of sound. This basically means a person is able to tell where the sound is coming from, whether it's from the left side or the right side or the back. When you have only one ear that is functioning, you are not able to detect where sound is coming from. There is also an issue with speech understanding in noise and speech understanding from the ear that is not implanted. In the long term, the ear that is not implanted is not able to perceive sounds, and this would also lead to degeneration of the auditory pathways in the hearing system.
After knowing the importance of listening with 2 ears instead of 1 ear, her parents decided to proceed with the second cochlear implant on the right ear. The second surgery was scheduled on 12 September 2013, and we had the switch-on party on 8th of October 2013.
Research has always shown that the earlier the implant or the usage of hearing aids, the better the outcome. A child is exposed to sounds, and this in turn stimulates the brain at an earlier stage. The brain is ready to learn language at very young age, and this would be a golden period for them to develop language. When it is delayed and a child is not stimulated until 3 years of age, the outcome may not be as good. Basically, to intervene, we need to identify or detect the hearing loss at a younger age. The best way of doing this is through newborn hearing screening. The test that can be carried out is non-invasive and quite fast. There's 2 types of tests that's being carried out: the autoacoustic emissions test that checks the cochlea, or the automated auditory brainstem response test that is testing the auditory nerve itself. And this would tell us if the child has a risk of hearing loss. And if there is, further diagnostics can be carried out, and a child can be diagnosed with hearing loss by the age of 6 months. And as soon as the diagnosis is done, proper intervention, be it hearing aid fitting or cochlear implants or medical or surgical management, could be carried out to prevent the effect of hearing loss.
Your child's hearing is important for speech and language development. With current medical technology, even a child with profound hearing loss can be given a chance to hear. This is vital for speech and language development. Early detection and treatment for hearing loss is crucial and leads to better outcome. Remember, all of us deserve to hear, including your baby and child. Together, we can make a difference.